Let's be honest, a trip to the doctor's office can be a bummer. Well, maybe not anymore. Here's Dr. Daniel McGee with Associates MD Medical Group on how their group is attempting to change the way you feel about going to the doctors. Dr. McGee, good to have you on the show.
Thank you.
How are you?
Very good. Thanks for asking.
You know, you look very, very chill for a doctor, but I guess that's kind of the point of this whole thing, right?
Yeah, absolutely. Medicine's about people and remaining approachable and, not too formal, I think helps a lot as far as, interacting with people in a way in which we can really get into talking about health.
Yeah, all right, so Associates MD Medical Group, that is the group, and you have locations across South Florida, and it's a different way to practice medicine, right?
Absolutely.
So tell us a little bit about it.
Yeah, so as you said, Associates MD Medical Group, it's a multi-specialty group practice, so we have primary care, family medicine, internal medicine. We also have cardiology there, as well as orthopedics and physical therapy. We also do some diagnostic testing at our centers. But really, I think what distinguishes us at Associates MD Medical Group is the way in which we provide that care. And that's really centered around customer service. More of kind of a boutique approach where, this is kind of an individualized approach to care. At the heart of that relationship in health is a connection where, really believe the doctor and the patient are more partners in their care.
All right, so let's dive into some specifics about that. So specifically, what does that mean? Because, we all have those experiences where you go to the doctor's office and you're waiting in the waiting room forever, and then the doctor comes in and doesn't even look at you and whatever and leaves, and that's that. Not with you guys, though, right?
No, not at all. Certainly, like any office, you might have a wait. I mean, that can happen.
Sure.
We certainly try to avoid that. But one thing that we do, for instance, in my office is instead of me, say, having my nose in the chart or in the laptop, as now we have electronic medical records, I use a medical assistant, someone there to help me document a lot of these notes and data that we're collecting in the interaction, so we can really have more face-to-face contact. We can really connect with people and provide an environment where space is opened up, so someone can share intimate things about their health, intimate things about what's going on in their lives, and we can really get down to the heart of what's happening for someone who may be coming in with a complaint of anxiety or insomnia, fatigue, pain, whatever it might be. Medicine's kind of resorted a lot to just looking at symptoms and trying to treat those symptoms versus really getting at the heart of what's happening for someone. And that takes time, and that takes the space and the ability to connect with people.
So what was the genesis of the idea to really make yourselves about customer service? Was it that you personally had a bad experience at a doctor? Were you just getting a lot of bad feedback from people? What brought it about?
Yeah, that's a good question, actually. I haven't thought about that specifically and how that
we
all
ask
happened.
the really tough ones on this show.
Yeah,
we are stumpers.
That's
yeah.
Right. No, but it's a good question in the sense that I think that probably evolved over time. If I think back to my medical school training and residency training, there's some instances in which I worked with excellent doctors, but probably because of the way medicine's structured now, it tends to be very fast-paced. The way it's structured is often we have short visits or short interactions, whether that's in a clinic or in the hospital setting, where doctors often don't have the time and resources to really spend with people. And sometimes I may have heard as a student a patient referred to as a case. There's a case of abdominal pain. Here's a case of a cardiac arrest. The patient may be present. And that took some of the human, care out of that whole
interaction.
Nice
to meet you, Mr. Case, number 1412. Yeah.
Exactly.
Right.
And I think that goes back to probably the history of medicine and how that was, put together in the way we're educated. So to me, that really, I think, probably just didn't sit right. And I felt like, studies even show us now a lot of the healing process revolves around compassion and care. And oftentimes as physicians, it's difficult to, how do you integrate that without getting too caught up in that?
So basically, in conclusion to this part of the conversation, you are the opposite of Dr. House.
House MD.
Right?
Right.
You are
Dr.
the
House,
complete opposite of Dr. House MD.
Right, yeah. Much shorter as well.
You don't have the British accent either.
No.
Yeah. You don't have any of those things going on.
Yeah, right.
Integrative health medicine is something that you're particularly passionate about.
Yeah, absolutely. And this kind of goes back to, I think, what you mentioned before regarding patient interaction and really this relationship between the patient and the provider or doctor, practitioner being more of a partnership versus this traditionally paternal role that doctors would often have in approaching, I'm going to tell you, the patient, how it is now. And certainly we're consultants, we're advisors, but in this day and age, you or anyone else can get on the internet and look up everything about your symptoms and find out a huge amount of information about it. And some doctors discourage people from doing that. If someone comes in with that kind of information, I'm fine with that. Let's explore that together. I'm more of a consultant and ultimately someone who's going to help guide someone through a journey towards health and making a decision. But integrative medicine really is that short answer, kind of intelligent combination of complementary alternative medicine in the context of conventional medicine, scientifically based or evidence-based medicine. So it's not rejecting conventional medicine by any means, and it's also not just uncritically accepting complementary alternative medicine. It's kind of trying to take the best of both worlds, so to speak.
So, forgive my ignorance, so does that include things like acupuncture and things like that?
Absolutely.
Holistic medicine?
Yeah, acupuncture. Yeah. And I don't personally practice acupuncture, but depending on someone's symptoms, disease process, or what they might be receptive to, I certainly will recommend that or make a referral to someone who might do that if that seems warranted. And really the critical thinking that we need to apply to these therapies often also looks at, okay, what are the risks with something like acupuncture or manual manipulative therapy or some sort of vitamin or nutrient? And if the risks really are minimal, then the evidence needed for that benefit doesn't necessarily have to be weighed as critically as something, say, like maybe a drug, which some may have, say, more serious possible adverse events, or a procedure.
Right.
And so they're all valid, I think, within that spectrum of care. It's just the degree to which we are critical of how we place that importance on applying those. It can vary.
Fascinating. Really interesting stuff.
Yeah.
You guys have locations across South Florida, right?
That's right. Yeah, absolutely.
Okay, where are they?
So our locations right now in Broward County, we are located in Davie. We have Plantation, as well as Weston right now.
Okay. The episode is about to end. This is where Dr. House would save the case, would come up with something. Oh, it's gangrene, and then it would be over. Right. So, congratulations. I'm going to assume that you just solved everything. Website people can find you out on?
Yeah, it's associatesmd.com.
Okay.
Yeah.
That's it, my friend.
Okay.
We'll see you back here again soon. Okay.
Thank you.
Thanks for coming in.
All right. Thanks.
All right. Take care. Thanks, Dr. McGee. In total, their group has 5 locations in Plantation, Davie, Weston, and Hollywood. When we come back, you're going to learn all about the Miami Gay Men's Chorus and why you need to check them out. Stick around.